Thank you very much. So I was asked if I could give you a bit of a context for how the Gravitate-Health solutions, the G lenses that we're going to look at, will function within the big legal environment of the European Union. And you've already had a taste of that this morning with Fulvio Raffaelli talking about the European Health Data Space legislation. What I'm going to do now is just try and put our European Health Data Space legislation within the context of all the European legislation that is relevant. And it does not, it advances like this. So this is a terrifying picture. And I want to give you a little bit of reassurance. I'm not going to go through each one of those pieces of law. But what I want to give you with this is an idea of how European health legislation works. And you can see it's a bit like a sandwich. You have the bread of the sandwich, and at the top you've got the reference within Article 168 of the Treaty of the Functioning of the European Union, which says that it is a function of the European Union to protect public health. But, and it's very important to remember the but, that is a function that the European Union may support but may not direct. The European Union does not have the right to pass legislation that tells member states how to run their healthcare systems. That is the right of each member state. However, at the bottom of the sandwich, you have two other pieces of legislation also embedded in the Treaty on the Functioning of the European Union. And the reason I'm referring to the Treaty on the Functioning of the European Union is because any piece of European legislation must find its basis in the Treaty on the Functioning of the European Union. The European Commission cannot propose legislation the area of which is not provided for in the Treaty on the Functioning of the European Union. So sitting underneath, we have two other articles. Article 114 on the functioning of the internal market, and Article 16 on data protection. Why have I created these as a sandwich? Because if you think about it, anything that we do in digital health falls between these two slices of bread. On the one hand, everything we do in digital health is about promoting safe healthcare. And on the other hand, it requires tools, systems, software, devices, medicines, which must be traded on the internal market, so Article 114. And then when we're talking about it being digital health, we're talking about the exchange of data, often the exchange of data related to an identifiable person, a patient, so we have data protection. So those are the framework of all the legislation that we talk about and that we come back to again and again. And then the filling of this sandwich, you can see many different types of legislation. Legislation relating specifically to the internal market and the transfer of goods, more technical legislation like the Health Technology Assessment Regulation, which helps us make sure that the products that are put in the market are assessed in a uniform way, similarly with the Medical Devices Regulation. We also have there at the bottom product liability, because when European citizens, whether they are health professionals or patients, use a service, they want to be sure that if something goes wrong, they would have redress, so product liability. And then we have a number of other pieces of legislation that I'm not going to go through. But see, sitting in the middle there at the top in the green section, you can see the European Health Data Space Regulation. What is important to take away from this image, and I would only want you to take away two things. One, as I've said, it's within a sandwich of health promotion, data protection, internal market, and that the European Health Data Space Regulation does not exist in a vacuum. It has to interact with all of these other pieces of legislation. And that can make things quite difficult, because if, for example, like in Gravitate-Health, we develop a solution that could be a medical device, it has to comply with the Medical Device Regulation. If that medical device then wants to talk to an electronic health record, it has to comply with the European Health Data Space Regulation and also with the Data Protection Regulation. If a citizen is harmed, they have to have redress under product liability. If we want to put it on the market and have it reimbursed, it has to go through health technology assessment. So it's all related. But this is the subject matter of at least one university course. So that's it. I'm not going any further. But let me, oh, I've gone the wrong way. Let me give you a little bit of the history of how we got to this situation. So I'm going to take you through several slides like this, which show where we've got to. At the very beginning, we focused on safe use of physical products. It was very much about medicines. It was all very much about safe medicines. That was the first legislation in this area in the European Union, and it dates back to the 1990s. Then we began to realize that software was part of how we delivered medicine. And we began very slowly through the early medical device regulation to introduce the idea of software as being part of healthcare that needed to be regulated. Then we realized that all of this involves data, and we started to introduce data protection regulations, notably the GDPR, but that had its first lease of life in 1995. And then eventually we get to fostering the use of data. And that's really the big transition that we made, moving from simply regulating physical products to regulating and supporting the use of data. Perfect. So, as I said, we started off with the safe use of physical products. And I'm not going to go through this in all detail, but you can see how we moved from a very product-based, very top-down legislation on liability, and that we are now in a phase of revising the 2001 legislation on medicinal products. And the reason that I point that out in the context of Gravitate-Health is because this is the piece of legislation that we hope is going to say that electronic patient information is going to be required at European Union level. It is at the moment, there is no rule around electronic product information. The EMA, the European Medicines Agency, accepts it, but it is not required. The new legislation, which we hope will be adopted next year, will, we hope, have a transition period where we have a period of time where we have both paper information and electronic information, and eventually transition to electronic product information, which includes the patient leaflet, but also includes other product information. But this is not definite yet, because this legislation is still being debated at the moment in the European Parliament and Council. And the idea is that probably towards the end of next year it will be finalized, and then there will be likely a 2-year transition period before it comes into force. And again, with the safe use of software, we have moved from an early legislation in 2017, which updated even earlier legislation about medical devices. And again, now in 2024, with the new product liability legislation, recognizing that software-based medical devices also require product liability, which is, of course, also relevant for Gravitate-Health. So this is another anchor Gravitate-Health has. And then data protection and cybersecurity. I'm sure everybody knows and loves the GDPR because it's everybody's favorite piece of legislation. And the GDPR was in many ways a piece of legislation that closed data. It did not foster its reuse. The European Health Data Space Regulation opens that up, and I'll say a bit more about that in a minute. But what is also relevant is that in 2024 we had the Cyber Resilience Act. And I'm not sure if you know, but just 2 weeks ago, the European Commission announced the new plan for cybersecurity in hospitals and for healthcare providers, which will be a new action plan. It'll be very relevant, again, to a product like Gravitate-Health when we want to use products that share data, and we have to ensure that that is done in a safe way. The last phase is the European Health Data Space Regulation, which is it's there to foster the reuse of data. It's there to open up data. It's there to make sure that data can be shared for primary use purposes, for e-prescriptions, for treating a patient who's traveled across borders, for making sure that a patient who moves from one hospital to another within their own country can have access to their health record in a seamless way. That is, of course, all based in the European Electronic Health Record Exchange format that we heard about this morning. But the big emphasis is to recognize that data, to use a phrase many people use, is the new gold or the new oil of the healthcare system. I think neither gold nor oil are actually the right image. I prefer to use lifeblood. It is what makes healthcare systems work, and so it has to be shareable. And that's really what the EHDS is seeking to do. As we've heard this morning, one of the main tools for that is the European Electronic Health Record Exchange format, and you can see that it is beginning to build. And you can see that the first phase, which is more or less operational, is patient summaries and e-prescriptions and e-dispensation notices being available. This is crucial for Gravitate-Health because Gravitate-Health will seek to pull information from the patient summary and help patients exercise their e-prescriptions in a safer and more informed manner. And in due course, who knows, it may also be able to take some data from lab results to help a patient understand information about the medication that they've been prescribed. But this is why the EHDS is such a big enabler for what we're seeking to do in Gravitate-Health. The big focus point for Gravitate-Health is patients' access to e-prescriptions abroad and nationally. And the object of the exercise within the EHDS is to make sure that an e-prescription can be seamlessly passed either from one country to another or between countries. Gravitate-Health seeks to help that by making sure that the e-information taken from the e-patient leaflet that is available, but as I've said before, doesn't have to be available yet because that legislation is still being debated, in order to enhance that information so that patients are more confident about the medicines that they take and, we hope, comply better with the treatment regimes that their healthcare professionals have worked out for them. Because I'm sure, as you all know, non-compliance or non-adherence is one of the biggest costs to healthcare systems. It is a cost both in terms of wasted opportunity, patients who, for one reason or another, don't take the medicines that they've been given. It's a wasted cost also in terms of the production of medicine, but it's also a wasted cost in terms of what happens to those medicines, which often end up being flushed away down toilets, which isn't very good for our groundwater. There's other legislation on that, which I haven't talked about. But the idea is that Gravitate-Health, sitting within this ecosystem of legislation that I've tried to explain to you, will help drive that ultimate goal, the top of the sandwich, of safer and more efficient healthcare systems for Europe. There is also a piece on the doctor accessing the patient summary for care purposes. I'm not going to go into that now because that's not so much the purpose of Gravitate-Health, which is much more focused on the e-prescription. But of course, when a doctor, as I've just described, prescribes a medicine, they want the patient to take it. So the better information the patient has in order to support them and build their trust in taking that medicine, the better it is. And with that, I will end. And thank you very much. If there are any questions and if there's time, of course, I'm happy to take them.